Good afternoon. Welcome back to the day spa. And we have you scheduled in for a checkup from the dermaplaning that you had done a couple of weeks ago, as well as a full facial and extraction as necessary. How has the skin been treating you for the last couple of weeks? Pretty well? That's good. Yeah, normally when it's your first dermaplaning session, when the hair grows back and you get that very prickly feeling sometimes, yeah, a lot of people don't necessarily expect it. Okay, but it's been treating you pretty well. Good. Well, one of the really prominent benefits that we see with any kind of dermaplating or real good exfoliation like this, we can also do it with threading, is that your skin is much more susceptible to the products that we will put on your face afterwards. So I would like to continue this treatment with the dermaplating to exfoliate the skin, to remove all that baby hair, and then to cleanse your face very nicely while it's bare. Do a couple of extractions if they're needed, and then continue to finish up the procedure with a nice cleansing but moisturizing treatment that will help rejuvenate the skin. Okay, that sounds good. Fantastic. As per usual, I'd like to clear your skin. Even if you don't have makeup on, it's always good to do this because it will remove the topical dirt and dust and oil that we normally accumulate without even realizing it. Okay, just going to take some astringent here. So you did like the procedure last time. It's a very relaxing procedure and makes your skin just glow. Get your chin and your neck. Beautiful. I can tell that your skin is doing quite well, actually. A lot of the redness has been reduced. Not that you had bad skin when you first came in here, but it definitely is improving too. Okay. I'd like to get a little bit closer and to see, just kind of stretch out your skin in certain areas and to see what is going on. Okay? Have you been having any problem areas at all? Yeah, there's still a little bit of breakouts on the chin. That's very common. Not necessarily a bad thing, but our chin, especially this area right here, it is one of the areas that we break out when we're under stress, hormonal fluctuations, things of that nature. Do you have a stressful occupation? Feels like it. Understandable. Okay. Well, you do have a couple of breakouts in certain areas. Nothing that's too major. Definitely something that we can handle. Okay. The first part of this, and I'm going to be doing this procedure a little bit differently than last time. I'm going to be doing this from an upright position because I want to see how your skin naturally reacts to gravity. And when I pull upon it, I want to see how it lays to rest afterwards. Okay, I'm going to get a brand new microblade. I think I'm going to start with your forehead this time. Just going to pull the skin tight and proceed to remove the top layer as well as all of the baby hairs. One of the other things that you can do is if you have a microblading system at home, if you want to do this in the comfort of your home, you can also do that as well. It's really not that much different than using a regular razor that we would shave our legs with or something. But this is a little bit more of a precise razor that is intended for getting very, very small areas and more than just the hair, but also the first layer of skin. Does it feel okay? Okay. If there's any areas of tenderness or if it's uncomfortable, let me know, okay? Move on to this side. Pull skin tight. And you do have a little breakout that's going on over here. So that's an area that we'll come back to and we'll focus on during the extraction phase, okay? Now your chin. Do you mind looking up for me a little bit? Thank you. And do you mind going like this for me? Okay, we're going to get the area above your lip. Just going to very carefully come around your nostril. Gotta be very careful around this area just because it is so curvaceous. Do you mind feeling your face and feeling if there's any areas that I might have missed? Just gonna run my fingertips along your skin and see if there's any patches. It does look like you got a couple above your eyebrows. This is gonna shape your eyebrows a little bit. Is it okay if I get this ridge right here? Okay, and I'll take away some of the fuzzies that kind of come down into the eyebrow, but it'll give your eyebrow a little bit more distinction as well. Okay. Now the other. Just gotta feel your face a little bit and see if there's any prickly areas that I forgot, okay? I think I'm going to get your neck a little bit more. Do you mind looking up for me just a little bit? Thank you. I want to get right along your jawbone here so that this area is nice and smooth. Stretch your skin. Now this is where some of the areas of breakout are, and this can sometimes be an area for very delicate hands because I don't want to cut any of your skin unintentionally. It's difficult sometimes when you have a breakout or swollen areas. Okay. To the other side here, I'm just going to hold your face. How about your sideburns? Do you want to trim those up a bit? Sure. This area right here. Do you want me to angle it so it's more of like a natural? Okay. Yeah, we can do that. So we'll make it kind of as a triangle, and that way it kind of fades out a little bit. There we go. Beautiful. I'm just going to feel your face again. See if there's any missed spots where the hair is poking through. I'm going to dermaplane by your nose here. Not because you have any kind of hair, but just for the exfoliation, okay? And again on this side here. Okay, now that your skin is entirely bare, I'm going to close up my plate here. You have a very gentle astringent so that we can clear away any of the debris skin. Okay? And your jawbone. I'm going to shine a light at your skin, and now I'm going to stretch. I'm going to take a look at your pores, see how they have changed over the last couple of weeks, and then kind of assess the situation from there. Yeah, your chin right here is definitely an area that we're going to spend some time with. And I can also see that you have some in the T-zone area that we'll do some extractions on, as well as in the hairline. But all things considered, your skin has definitely been very resilient. Yeah, it's looking beautiful. I'd like to add some toner, and I'm going to do this with my hands. And this is going to hopefully allow your pores to disinfect a little bit before we take any tools to them. Or I'm sorry, this is astringent. The toner is what comes afterwards. Once we have a chance to clear those pores. Okay, focus here on your chin. One of the other things that I'm going to do real quick, with your permission, is that it's nothing to be ashamed of, but we tend to get these stubborn hairs here around our upper lip. And I'm going to take just a moment to go after some of the ones that are a little bit more prominent and discolored, okay? Okay. Yeah, the Dermablade doesn't always get these. So I'm just going to do a little bit of correction here where the Dermablade can't get. Just let me know if you need a break or you need me to stop, okay? Yeah, I know these are somewhat unpleasant. I'm going to go after the underside of your eyebrow. Again, it's an area that the Dermaplate is not always the best to be used on. So I just want to reshape some of the hairs on your eyebrows. Okay. Just let me know if you need a break. Make your skin nice and smooth. How's that feel? Pretty good? Alright. Let's take some time just to focus here on your bottom chin here. We have a couple of things that I want to extract with my extraction tool. And this will allow me to very precisely apply pressure and to wiggle out any type of infection, okay? And then we'll clear it up with some cleanser and some moisturizer. Okay, so I'm going to start here on the sides of your nose. Can wipe these areas down. That's a tender spot. Okay. We can move down to your chin here. Have you been stressed a lot lately? Sometimes when we're stressed or we have a bad diet or we don't take the time to relax, our body reacts in unusual ways. Well, acne is not necessarily a sign of stress, but with hormonal fluctuations, certain areas of the face are more prone to breakouts. And this is one of them. Okay. Just making sure the skin is clear before I move on to the next spot. Clear that up a bit. Oh, you really do have beautiful skin. We all suffer from the occasional breakout here and there. I'm going to move on to your forehead here. We're going to move on to your forehead here, so I'm going to apply a little bit of pressure. All right. Get this spot right here. You have a couple on your nose here that are maybe a little bit too tender for the tool, so I'm just going to use my fingertips if that's okay. Along to your cheeks and the softer tissue. Stretch the skin and look for any lumps and bumps. You have a couple on your hairline here I'm going to use the tool for. Okay. This is a little bit softer, so the depression might feel a little bit more tender. Is that okay? Wash the skin down a little bit. It's going to be a tender spot right here, so take a deep breath in for me and exhale. There we go. use the tool here on the very side near your sideburns, okay? Okay. Just going to take one more good look at your chin area. Just do a couple of manual extractions here, okay? Breathe in for me. There we go. I think we're all nice and clear. I think your skin is all nice and clear now. How's that feel? A little tender right now? It'll get better. I'm going to take some toner and just apply this to your face here. And this will allow your skin to calm as well as help reduce the size of your pores while keeping them nice and clean, okay? You just want to pat this in. Do you mind looking up? Thank you. Now that'll be nice and cool on your skin. And while that is sinking in, I'm going to add a nice, gentle moisturizer. And this will allow your skin to fully absorb all the vitamin C, the lactic acid, and the toner. And this will allow your skin to moisturize a very clean palette, okay? This will absorb into your skin probably within the next 2 to 4 minutes. It's actually not that fast of an absorbing moisturizer, but that's okay. It's very effective. Just stroke up. We want to work against gravity here. Here. And your décolleté. close your eyes for a moment. Okay, go ahead. Beautiful. Gorgeous. Alright, I think you're all set. We'll see you maybe in a couple of weeks. Check in on the progress and maybe schedule for another topical facial and just keep improving. Thank you so much for stopping in. I will see you next time.